hoping to get to questions at the end. So moving on to our agenda. As I said, I'm the co-director. Some of you may know Dr. Patty Solomon, and this year she is on a research leave. So I've had the opportunity to become familiar with this fabulous Masters in Health Management program, and with fabulous instructors, and Dr. Catherine Wise is one of our co-leads. Of course, some of you may know her from the leadership course, amongst other courses in the MHM program. So we were able, with Catherine's help, to coordinate with tonight's guest speaker. Of course, everybody knows our great staff that manage our program, Michelle Benjamin and Robin Patchett, who are both on the line this evening as well. So we're really glad you can join us. You can see our time breakdown, and that's our plan to have everybody on their way at 8:15. I think I'm going to be turning the next slide over to Catherine. Catherine, go ahead.
Great. Thank you all for joining us this evening. And so we wanted to just give you a bit of an update regarding the Masters of Healthcare Management program and where we're at to date. So this year is our first year where we have introduced a full-time stream along with the part-time stream. So right now this year we do have 63 students currently enrolled in the program. As well, over the last year we went through an institutional quality assurance process, which confirmed our ability to offer an academically robust program and a well-governed program. And through that, we've come up with some best practices as well as some next steps to only improve upon our program. We're also beginning to really explore various aspects of research related to healthcare management. And currently we are in a study, and a few of you have participated in it, where we are exploring the students and instructors' perceptions of teaching presence in an online graduate program. And not only will this help inform current students and how we deliver our program, but also help us inform best practices around online education. And like I mentioned earlier, we launched our full-time stream in the fall of 2018 with 17 students who will complete their degree in 12 months. And again, we are offering this option again for the fall of 2019 with students predominantly from all across Canada, but we are seeing more and more international students. Also, this year, we're all part of this, is the Healthcare Alumni Network with this inaugural lecture this evening. And next slide. So we are looking at developing the alumni network, and really we are looking at you as our alumni and our current students to help inform this process. So what it is will be made up of current and representatives from each cohort that have graduated, and helping us develop and come up with different gatherings, networking opportunities, job postings, just a way to keep everyone connected, and also to help current students through the program. Who can be involved? It really, everyone could be involved if they want, but what we're going to be doing is reaching out via email over the next couple of months to ask for some volunteers to help lead this. So we'll have representatives, like I said, from each cohort, and then also we're looking for some former students to take on more of a leadership role in terms of the governing of the network. Our next event is tentatively scheduled for June the 9th. And this is the weekend of the spring residency. It is the same week as the Canadian College of Health Leaders Conference. So we are going to have it on the Sunday around the GTA, and hopefully trying to get everyone into a face-to-face networking event. And it will be wonderful to see everyone at that event. So stay tuned for some email updates regarding the network and hope to have as many of you involved as possible. Great. So without further ado, I thought I would introduce our distinguished leader. I had the opportunity of working with Kimberley, Floyd, quite a few years ago at the Toronto CCAC. And in that role, in our management roles, we were colleagues, and I was just taken back by her ability to navigate a really difficult situation and system, but also really inspire her team to work through a lot of the challenges. And so I've been watching her career over the last few years, and I'm absolutely thrilled at where she's gone. And she's now currently the Vice President of Home and Community Care at the Central West Local Health Integration Network. So in her current role, Kimberley is responsible for all aspects of healthcare service delivery as it relates to home and community care. She has over a budget of over $140 million, with 275 frontline staff and over 25 service provider organizations. She's also been a big champion for the role of care coordinators and the day-to-day operations of her team. Some of her achievements today have been to bring research into the CCAC, now the LIN, where she introduced the hand-child model of care for children with developmental coordination disorder within the school system. She's also been involved in the co-lead of a new provincial strategy on wound care, and also has been part of the Clinician Digital Health Council, a member of the GTA Rehab Coordinating Council, and a member of Complex Care Kids Ontario Leadership Table. Kim has a social work degree, as well as a Master's of Health Sciences degree in Health Admin from the Institute of Health Policy Management and Evaluation from U of T, and is a certified health executive with the Canadian College of Health Leaders. In her free time, she enjoys to spend time with her husband and teenage daughters and go camping and coach and play soccer in her spare time. So without further ado, thank you, Kim, for taking the time to speak with us this evening, and we will pass the microphone over to you.
Great, thanks, Catherine. Just wanted to say hello to everyone. I will close my camera off, but I'm really pleased to be here and be part of this inaugural event. So I'll look forward to a bit of a dialogue after my presentation. Michelle, have you passed it over already?
Yes.
Great. Thanks, Michelle. So everyone can still hear me? We're still good?
All good.
Good, thank you. So I'm really pleased, and I'm scrolling through some of the list here. So I know I have some friends around the table. It's nice for you all to join tonight. Tonight I'm going to share with you my journey in terms of leadership, give you a bit of a sense of some of how you can work through some of your career path, but I'm also going to share some of the elements that I think have been really key in helping leaders navigate through system transformation. And much of my examples will focus on an Ontario context. So for our friends across Canada, I think you can still relate to a lot of the things, and quite honestly, right now in Ontario, there's a lot of change afoot. So I hope that these examples will be helpful. And Michelle, it doesn't look the same as it looked last night. So could I actually ask you to take control back and do the flipping of the slides for me? We'll just give it 1 second. Great, thanks so much. So as I said, I want to start a little bit with my journey and where I wrap up a little bit about the successes and challenges. I want to start being pretty raw and open with you folks as emerging and natural leaders in our healthcare system, and let you know where mine started. This picture is a picture of my mom. I am someone who has been very much touched by the healthcare system at a very young age. My mom had MS, and from the time I was 6, that's all I know in terms of interacting with the healthcare sphere. Through that experience of having good experiences and some not good experiences, having lots of people in and out of our home, I really got sparked by what, the developmental features of supporting families, patient and a family, in the context of a chronic disease. And so, maybe a bit of some scars, and I probably need a bit of a couch to work through some of those. But I think, as leaders, we all have a burning platform, a burning example of why we want to give back and contribute to improving the healthcare system. And for me, hands down, this was the biggest influential personal experience that I've had, and I can tell you that I still draw on that experience often in my day-to-day work, and as I've navigated through trying to help all of us improve the healthcare journey. I think another piece that's been really critical in my journey is looking at alignment of values. So whether it's different roles, different experiences that I've taken on through my leadership path, I've always either known when my values weren't aligned with an initiative or an organization, and I really encourage emerging leaders to always take the time to think about how do our values align. And in particular, I can tell you in one of my paths along the way, I found a mismatch. And so when I started working in healthcare, again, I began in the community. I've kind of come full circle, but started working with patients and families who ironically also lived with MS. Went to school, got my degree around social work, and again, that influential personal experience really drove that. And then had an exciting opportunity to work in a rehab and continuing care hospital, where I really, grabbed opportunities to say, how can we do it better? I will admit, sometimes I can be potentially, to some may seem a bit pushy in terms of wanting to see that altruism come through and use inquiry to say, why do we do it this way? And in that experience, I ended up staying in that facility for over 12 years and, took on different roles, from a social worker to a care coordinator to then being tapped on the shoulder and asked to be a manager. And through that experience, I think some of the lessons really grounded me in making sure that those values are aligned, because there was one, really pivotal time in that path within that role where I could clearly see my values around client self-determination and some of the ways we were tackling patient-centered care were not aligning. And so it was pretty quick to say something doesn't feel right. And it was at that time that I knew that it was time to find some new experiences. But in doing that, there's lots of times where I had to take some risks and, really make sure that I didn't allow titles to necessarily get in my way to try and push improvements in the healthcare system. So when I talk about risk-taking, it is, you know, how you take risks that's really key, and, you know, having relationships as you work alongside people and partners and patients and families, quite honestly, in order to be able to be successful as a leader. After I had stayed in that organization for, you know, 12 years, and quite honestly, it really, those were my developmental years in trying to understand the complexity of the healthcare system. I knew that, as I said, I needed to see some different perspectives and not get siloed in some of my thinking, and was able to move to, over, you know, about 7 years, 2 different acute care hospitals. And in each of those experiences, you know, started in a role really committed to improving the patient experience, so took on roles of patient relations advisor. And I think because of the openness, the inquiry, and, you know, careful respectfulness of challenging the system at times, I seem to find myself getting tapped on to say, you know, do you want to take this role on? And interestingly enough, as a social worker, was asked to lead the nurse scheduling office in one of those acute care hospitals, and I thought, heck, I'm not a nurse, I don't live this every day. How could they possibly ask me to take this on? But, you know, sometimes in those moments of lacking self-confidence, we can really push ourselves and challenge ourselves, because the success of leading that initiative and that program was more about the structure, the relationships, the taking the time to listen to people that allowed me to be successful. And after I had done some of that work, as many of you probably have experienced over the last few years as you've come into the McMaster program, I felt the itch to come back to academia and to grow more, and so took on the opportunity to do my master's in health admin program. And you know, it really engages as a lifelong learner. I think it's really key, not only that we have those opportunities to push us intellectually, but also find new mentorship opportunities. And as I did that, that's when the exciting world of home care reopened for me, and I had the privilege to work alongside Dr. Wise in that environment. And all along the way, as you kind of hear a bit about my journey, a few of the takeaways is I watched other leaders. I watched leaders for what they did, for what they didn't do, for how staff reacted, and really started to build a repertoire of, you know, what are some of the successes around leadership, and what do I not want to do when I'm working with staff, and how do you balance that piece of being humble, being authentic, but also being there to champion sometimes some really challenging individual situations, staff situations, and system situations. So part of what I feel has been a bit of the secret in my success is really taking time to step back and learn from those different perspectives. And another piece of advice I would say to folks is, you know, getting those different experiences. If you watch my journey was not always linear of a step. Sometimes I took a step back in my journey in order to learn something new, to take more time to reflect, to learn more, quite frankly, about myself and my style and what the strengths or opportunities for growth were. So those are some of the first nuggets I want to share with you. When I think about being a champion of change, and I'll give you several examples throughout this talk of some of those changes that I've been able to work through, I think it's as a leader, it's a fine balance of influencing, but also sharing power. So sharing power with your teams, with your colleagues, with partners, and allowing that creation of autonomy and accountability that need to go hand in hand. But I will caveat that to say it is really hard sometimes. For me, some of my pitfalls in how I've carried myself at times and some of those reflections are that, you know, sometimes you're holding on really tight. You've got an initiative, the stakes are really high, there's a lot of pressure, and so, you know, how do you find that sweet spot between sharing power, allowing autonomy, but also really driving accountability? And it really, in my perspective, is an art and a science. But I think as leaders, if we can understand that that's some of the challenges that we're trying to find, I think even just that thinking time to reflect on that is really important. The last piece I'll say before I move to the next slide is that emotional intelligence, in my opinion, is absolutely critical in leadership in healthcare right now. We have a lot of competing priorities, a lot of complexity in the health system, a lot of demands that our patients and partners are expecting of us as we lead through this healthcare system. And being able to read situations, read individuals in our teams, read partners, and make that appropriate interpretation so that you can have good dialogue, I think is absolutely imperative. Michelle, if you could move to the next slide, please. Here's just a few things, and I think you'll have access to my slides after, so I won't read every element of this, but you know, there's lots of research to talk about what great leadership development looks like. And you know, I think if you think of it both from your own development as well as trying to inspire and create the cadre of leaders that underneath you and alongside you, we really need to ensure that we've got those right role models that have the sweet spot of all kinds of leadership. So we know that leaders need to learn from other great leaders, both what to do and what not to do as my previous examples. And also the more systematic we can get in terms of agreeing to some of those leadership principles, many of which I know that you've reflected on around some leadership methods and approaches and practices and models, the more we can turn back into the production of great leaders. And then sources of energy, really taking time to take care of ourselves. I'm going to really talk a lot tonight about the importance of mentorship, having those safe places that you can lean on, but knowing that it's okay for us to be honest in these times, to say, man, some of these situations and leadership approaches we need to take are really challenging. So you know, being open to being a bit humble at times and knowing you're going to make mistakes. I have tons of scars throughout the years of things I've done that I learned from, and I think that's really valuable. And also, some of you on the call will know sometimes you just have to admit you make mistakes, even right to frontline folks or patients or families, in order to get some of that credibility as we go forward. You can move along, Michelle, thank you. So I think I'm talking to the converted here, but just a reminder that, you know, by us focusing, taking the time you're doing tonight, thinking about leadership, reflecting on your own journey and where you can learn some tidbits from others, it gives us the opportunity to really focus on how do we develop others around us to get some systematic thinking in improving the healthcare system. We also want to really create healthy organizations. You know, you think of lots of organizations do staff satisfaction or employee engagement surveys, and when you look back at a lot of the questions that we as organizations are looking for in those surveys, it is really about how did we find that balance of autonomy and accountability, and how did we make our teams feel valued that they could then deliver the best care they can for our patients. So, you know, I think the more we can take time, that we're doing in looking at leadership, reflecting, and creating that space, the better our organizations can also be. And obviously communicating effectively and building teams. And, you know, when you think about team building, we often spend a lot of time thinking in our hierarchies within the areas or portfolios that we oversee. I'd like to suggest that we spend as much time looking horizontally in terms of our teams and thinking about how, you know, in my world right now, how are we functioning as a senior management team? Are we all rowing the same way? Because, you know, particularly for those in Ontario who know exactly what we're going through right now, the LHINs, you know, the future is obviously pretty clear that it's not going to be the same kind of structure in the future. And I know that every day I go into work, we've got lots of staff looking and watching, how are we carrying ourselves? Do I look stressed? Do I look worried? And my job right now, as I go through this kind of change, is to support our staff to be delivering the best care possible, keeping the healthcare system sustainable in terms of home care, and creating the world for them where they will be successful to work in this new structure. And so the last thing I want to do is create any of that uneasiness. So I constantly remind my colleagues and management team, we are being watched, and this is the most important time for us to shine as role models and support people to move through a transformation that is unknown and scary for some, and yet for others, really exciting in terms of some of the charge and where they can go for the future. You can go to the next slide, please, Michelle. Thanks. So this is often a scenario that as I'm working with my teams, we take time to reflect. And when you know a bit about my journey, one of the steps that I haven't yet shared was after leaving the Toronto Central CCAC and coming out to Central West CCAC, it was a pretty exciting time for me as I moved from a manager to a director. And within about 4 years or so, as we knew that the CCAC and LHIN integration was going to happen, that was for folks outside of Ontario, that was about 2 years ago now, I was given the opportunity and asked to support that integration, and so was seconded over to the LHIN to create that environment to make the integration successful. Honestly, it feels a little bit like, well, kind of like deja vu right now, but with a little bit more uncertainty. But you know, when I look at moving roles from there, I then was asked to take on the VP of Home and Community Care role after the integration. Each of those steps that I had in my journey, I had to really think about, I'm in a different functional role now. And I will admit, and for some of you who have done some of those steps, you may have also felt it at times feels uncomfortable. And if we didn't have all the tools and full experience, you know, it's almost like a new deer standing up for the first time and your legs are a little shaky underneath you. It's hard to think, where am I? Am I experiencing the dance? Am I in there? That's my comfort zone. I know how to execute this kind of way in terms of my leadership. But sometimes you have to be on the balcony a little bit. And I will tell you that for me, that's taken a bit of time to get comfortable with, because if I want to hold my teams accountable, I want to allow them to be autonomous, I need to be able to back away a bit and provide the environment and remove the barriers that allows them to be successful. I had some great leaders in my journey that did that for me, didn't micromanage, allowed me to make some mistakes along the way. I think that's what helped me be a better leader, because they were there to guide me, but they were appropriately on the balcony to support. So Sometimes, though, you do need to get in there and be in the dance, and you want to be alongside your teams. But I encourage you, particularly as you're moving in your career, to think about, where am I, where do I need to be, and where am I going to create the best value and the best work environment for my team. We can move, thank you. So, you know, the other way to look at things is, especially in these transformative times, which way do we look? Do we look forward and ignore the past? Do we look backward and dwell on the mistakes or the things that worked well or didn't? And I would submit to you that we really need a blend of both. We've all heard, you know, that you need to have a compelling vision of the future in order to guide teams through transformative times. And you need to kind of get people behind you, embrace the kind of change. But, you know, even when I think of this transformative change going on in Ontario, we don't want to just throw the baby out with the bathwater. And so there's sometimes where we do need to look backwards, but if we're trying to, you know, use appreciative inquiry and think about the art of the possible, we do really need to think forward and look at different models and think, how can we do things a bit differently? Positiveness, in probably the bad phrase, but it is really important. And so sometimes I say, fake it till you make it. You know, how, even though I may be feeling uncertainty, how can I inspire my teams to say, let's step back, let's think about what we could do if we didn't have some of the barriers we have right now. And so that's why that looking forward is really key. I will tell you, though, in some of the scars that I hinted at earlier, we could have a really great, compelling vision, but we need others to understand it and to be able to come alongside us. And so compelling vision is kind of what's that future look like? But oftentimes as leaders, and I've made this mistake a couple times actually, we haven't been able to articulate the vision in a way that staff at different levels or stakeholders at different levels can really relate to. And if we don't do that really well as leaders, we lose people. And so a couple of the folks on the phone will have heard me say this example before, but Health Links is an approach, a philosophy of care that came out in Ontario in about 2013. And it was a low rules environment. It was a model that said complex patients who are high users of the healthcare system, who return often to acute care unnecessarily or potentially unnecessarily, are driving costs and impacting access to the healthcare system. And so the concept was, how do we create integrated teams who will work together and collaborate with the patient at the center to create a patient-centered care plan, not a provider-centered care plan, but more focused on what the patient goals were. Seems quite novel. Patients, though, would look at us and say, I already thought you worked like that, and we're more frustrated with us. I fully, got on board with this. This is from my roots and my early days of experience that I shared with you earlier, was really what I thought created a good experience for people with chronic conditions. And working in an interprofessional way really was important to me. And so I, walked alongside acute care and some primary care leads, and we kind of said, we're going to go hard on this, and we're going to spread it across the Central West LHIN. And we knew that we had teams within the CCAC at the time as frontline care coordinators who we believed that were central to doing this, and that we could, use the approach they did with assessment and add in this care plan piece that was a consistent document that all the partners wrapped around that patient's care would have access to. And so I came out, I pulled all my teams together, talked about this compelling vision, and started going, set targets. You know, I thought I had everything lined up, everything going tickety-boo. And when I looked back, you know, a few months later, the momentum at the beginning fizzled out. And for those of you who have done some QI work, you'll know that when you do an improvement initiative, you always have to say, okay, what's this added work going to do, and what am I going to take away that will allow our teams to really get behind it? And I made two mistakes. I didn't find a way. I thought staff would just adapt to blending the approach of how they would do this. And the second was that I didn't articulate the vision in a way that staff could really see. To them, nobody really wanted to look at these care plans because we hadn't done enough work with primary care to prep them. They got a care plan in their office and went, what is this? What am I supposed to do with it? And, you know, put it aside. So, you know, for me, the analogy of looking backward is not only to appreciate our strengths and challenges of the past, but physically to look back and see, have I articulated the vision clearly enough to get people on board? I can tell you with that example, we're now, you know, 5 or 6 years later, and we've tried to slow down, we've tried to bring our partners along with us and take time and say to the staff, what do you need to be able to do this successfully? And so we've been able to break some of that down, and I'm pleased to say that now we're getting more of our groove. But as a leader, to be a bit raw with you all, it was a bit of a blow to say, how did I miss that? Why couldn't everyone see it as clearly as I saw it? But it was a really good lesson for me to look at sometimes slowing down a little bit so that we can get the traction we need. We can move on, Michelle. When you think about, you know, strategic leadership, I just wanted to share a little bit. You'll see in a few of these next slides, I refer to the Dixon resource. And a lot of what I'm about to talk about in this next section is taken from the LEADS competencies. And in the past few years, there was a book called Bringing Leadership to Life in Health, Leads in a Caring Environment. And so that's kind of the context in the background. So if any of you have to do LEADS competencies and you think about some of the CCHL work, you can certainly lean back on this resource because it certainly helped me articulate some of these pieces better with my teams. But really thinking about courage, what courage it takes, and I talked at the beginning about risk-taking. You know, sometimes you don't always have the confidence, but I do encourage leaders to push themselves and be courageous at times. And whether it's, you know, a role of inquiring and asking questions and why do we do it that way and how can we do it different, or it's being a bit bold and saying, you know, we've done some research, we've looked at some data, and we think trying this new model of care is an appropriate risk to take. And I do believe that when we do go outside of our comfort zone and take some of those risks and be courageous, if nothing else, we're learning. And you know, I know in Ontario we call it pilotitis, so we're doing too many pilots, but sometimes you need to put those QI principles in and try some new things. I mentioned this before, that connection between authority and accountability is really key. And I can tell you in the past few years, as we've been able to do more, and I've been, you know, sometimes I feel like I'm pushing my teams harder than they would like, but they all have come back and said to me, I really appreciate that I know what the outcomes are, I know what you expect, and we're going to have a dialogue about it if I can't get there. And so, you know, I've learned how to manage that accountability discussion with my direct reports. So that's been very effective. And the last piece on this slide that I want us to think about is when we're leading, we are influencing. We don't always have to throw around a big hammer of power And even, you know, it's about asking people to change, and sometimes it's uncomfortable, and as I said earlier, sometimes it's exciting for them. But, you know, when I think about the emotional intelligence that I pointed out earlier, we have to be able to understand what's motivating the people that I'm asking to change, what's going to get in the way of that change, because we are humans. We'll go back to our comfort zone, and we really want to think through and have good dialogue about what that change is and how we can support them. We can move on, Michelle. So I want you to think about how we work in coalitions, particularly in our leadership roles. And you know, we can try and do something. We can try and slap something together and create a new model and a new approach or a new program, and we can probably try and implement things pretty quick. But the risk sometimes of doing that is it's just like my HealthLinks example, we didn't necessarily always bring people along. And so I want you to think about, in order to be able to travel far together in our healthcare experiences and improving the system, our leadership is absolutely integral to creating coalitions. And in the role that I play, you know, as I have directors reporting to me, we spend a lot of time at our team meetings talking about how do we create the coalition, how do we sometimes approach some really difficult conversations. You know, in home care, we're constantly talking about transitions and avoiding hospitalizations and supporting community providers when they have staff shortages or capacity issues. I could, you know, try and come down with something that's going to fix things pretty quick, but it might not stick. And I think that the magic is about building those coalitions. But I also don't want to be too naive to say coalitions are hard to build. They're hard to maintain, and they are messy sometimes. But if we focus on shared vision, shared goals, we've recently in our work have done a lot around bundled care. And, you know, how do we move patients across the continuum? You know, there's been a lot of interests at stake in terms of bundled care, of who does what, when. And I think the experience that we're about to go through here in Ontario related to our Ontario health teams will be very similar. There are subcultures within organizations and groups. And as leaders, to be effective, we need to be aware of those and know how to navigate that and have some of those conversations. We recently, as we're starting to work with partners about these Ontario health teams, have been quite blunt to say, how are we going to build trust? How are we going to make sure that we don't have blind spots where I think I know what primary care wants and primary care thinks they know what happens in home care, etc. And so that's the kind of coalition building that I think us as leaders in this healthcare system have to be very well versed at right now. And we have to admit, coalition building, to do it well, to make it sustainable, it will slow us down. But I think, you know, I would like to suggest that we need to take that time and at least build the foundation, because once you have that foundation, you got trust, you know what people's roles and responsibilities, accountabilities, authority, decision-making approaches, governance, all that stuff. Once you get that landed, the rest can really fly like a good flywheel. The other piece to think about, though, in thinking about coalition building is, what's that right size? How many players are coming together to build this strong approach to either a new model of care or the way we work together? And you need kind of some of that individual success of some of the strong thought leaders or partners within your area, but you also need to create the right structures so that you're getting the best out of everybody who's coming to the table. The other piece that I would encourage you all to think about when you think about building coalitions, sorry about that, is to be flexible. Go in with as much as possible without the baggage of, I know what's going to happen, I know what the outcome is going to be. Go in there flexible and willing to listen and hear. And there's been times in my career where I was like banging my head against the wall and saying, I don't understand why they're not seeing the other side of this situation or the complexity. And I watched one of a great leader that I worked with masterfully tackle that. And the way she tackled that was to ask questions. You know, rather than going in and trying to throw around your knowledge or your power, sometimes just sitting back and you know, for any of you who might get a little emotional charge at times when you're in some of these situations, it's breathing, like slowing your breathing down, but just asking questions. You know, well, what would this look like? Or what if it was to work this way? Or what do you think about this? Oftentimes, without the trying to prove yourself and show that you've got knowledge or power, when you sit back and do it in that more inquiry way, it has been very effective, in my opinion, and in the journey that I've watched. So, you know, I'd really encourage you to think about, but coalitions are absolutely imperative, and it's okay to not be married too much to all of our great ideas, because if we actually took a few opposing ideas and found the best out of both of them, we actually probably could build stronger coalitions and approaches to practice that more people could get behind. And there's some really neat work around integrative thinking, if any of you want to explore this kind of concept a bit more. And Jennifer Riel, R-I-E-L, has done some work around creating great choices by taking really polar ideas and figuring out, it's more than just how do you blend an idea. It is taking two very polar ideas and finding something that could work in the best of both. We can move on, Michelle. A couple words I just wanted to say about transforming our systems. We know that the complexity that we all live, there are small systems that are nested in those bigger systems. And when you make one change, it's like that pebble in the water, there is a cascading effect. And so my caution would be careful as you're trying to do some of this change, that you don't have those blind spots, that you don't think about what some of the unintended consequences are, and really look at embracing that knowledge and awareness of what else could happen. And Catherine and I and many of us who worked in the CCAC world used to joke and say CCAC stood for change, change, and more change. We know, and particularly now in our Canadian healthcare context, change is inevitable, and we as leaders need to both ourselves be able to adapt to it, but really support our teams to be able to adapt to it. A couple points about control, and I'd rather use the word kind of how do we create some of that autonomy, but we have to call it what it is. When we are in leadership roles, there is power. There is some power dynamics and elements that are going on, and so there is some awareness that if you have too much control, you limit the potential for allowing others to have a say. And yet, if you exercise too little control, you do create a bit of a, like, what way are we going? Who's doing what? And unfortunately, again, some of the scars I've experienced, I've seen both, I've been part of both, and that's where I think you have to say, what is that kind of engagement I want? Our frontline staff in many of our organizations have the best ideas, and they're not inhibited by some of the political stuff or the you know, the other barriers that we sometimes get held up in formal leadership roles. So my encouragement to all of us is find that sweet spot, involve staff, involve them early, but also, you know, we know that involving patients is really important as we're creating some of the changes in our system. And obviously the last point here is about how we have a role in influencing, but not necessarily always controlling. We have to help give people tools to be able to create some of the change in the system that we're looking for. If I think about transformational leadership, and I believe in many of you have done some learning around this, so I'll be very brief on this, but we know that successful leadership these days really involves this concept of transformational leadership, and obviously emotional intelligence and credibility and all those things go hand in hand. But you have to think about, how do I put it in practice? How do I put transformational leadership in practice? And piggybacking on my comment a moment ago about involving and engaging staff and partners, finding that meaning and that purpose, and understanding how we could co-create the desired state. If you think back to that example I gave earlier around my HealthLinks journey, I didn't take enough time to do this step. And so creating that meaning and articulating it for staff is really important. And then thinking about how do we adapt a process or system. And again, I've had the privilege of being the faculty of the Quality Improvement Initiative ideas. And so it's really, in my opinion, taking a lot of those principles and applying them to changing systems, doing it in small chunks, tests of change, getting both the naysayers and the people who are excited about the change together on your project team to look at some of those process changes. Communicate, communicate, communicate. I think far too often we're quick to just try and deal with the complexity of something we're trying to change, and we forget it. And so making sure that there's different modes of communication, different frequency of when we communicate is really important. And then having that growth mindset, and that's where it's both the inspiring people to think differently and influencing. In my current state, you know, we're I don't mean to have a violin with me, but we are a LHIN who is actually the most underfunded LHIN in terms of almost every sector of health in our region, across the province, but in our region. And we have to be able to think differently, and yet we're working within some really tight confines of how we deliver care, how much care, how many beds are available in our healthcare, in our hospitals, all those kinds of things. So that tough slugging of day-to-day frustration that our staff feel of not being able to meet the needs of their patients sometimes can get, you know, pretty demoralizing. And so we try and work to say, what could we do? This is what it is. We don't have the luxury of lots of dollars, but sometimes when you don't have all the resources you need, you can really push innovation. And you know, we've been coming back to our frontline teams lately and saying, okay, our caseloads are high, things are tough slugging. What is it that we could do different? If you were to say to me, Kimberly, take this off my plate, you know, it allows me to create some decision making to say, you know what, I can take that off their plate because it isn't the most important thing right now, and it's not allowing them to be successful to have all those things. But sometimes we've had to push them because they're used to this is the way it is, and we have to get those integrative discussions and create the space for dialogue about growth. We can move on, Michelle. Really quickly, you know, this is something that I often ask my management team to think about, and it goes along with the concept of really encouraging staff to think differently and contribute to the change. And so some people want to be nudged into the change, and some people want to be initiated, or they want to initiate change themselves. So you really want to think about who you're working with, and where are they at. Some people are very comfortable with the way things are done, and they don't want to see the change. I would submit to you there's probably a little bit of both that is the kind of environment that you want to be able to lead in. You need some of those naysayers to say, caution, if you do it this way, here's your pitfalls, but you also need some of those go-getters who want to help create paths of the future, and particularly in transformative times of complex adaptive systems. I do think we need a little bit of both. The other thing I'd suggest is you also have to think, is this a large-scale change or a small change, and the context of what your change looks like creates some of those different approaches that make more sense. If we move on, Michelle, thanks. So a couple points about how we really create some of this transformation. And so we obviously need to demonstrate systems or critical thinking. I will tell you, I think this is one of the harder pieces that some leaders really struggle with, particularly if they've, and I don't mean to overgeneralize, but particularly if they've been really close to the operational elements of executing. It can be kind of tricky to think of bigger than just the organization or the part of the system that you're leading. So we know that, in order to have this critical thinking and a systems approach, it does need a change in people's habits. We as leaders need to support kind of disrupting a bit some of the status, but being careful. No, you're changing. You could be changing roles. You could be changing identity. You're asking people to change the way they think. You're even, in some instances, might even be changing professional perspective and roles that people play. So you want to be careful about that. But we do need to really think as an integrated system. If we're going to be successful in transformation, we have to think bigger than our part. And I think that's really key for leaders to be successful. When you think about innovation, again, I've mentioned earlier, but that focus on QI, the balance between giving freedom of the future, allowing people to design and think creatively, but not so much liberty that you create chaos. Innovation is a key strategic priority in many organizations, and so you have to think as a leader, what's the environment that you're creating that allows risk-taking? How much? When? Those are some real key things that I think as leaders we need to think about. And orientating ourselves strategically to the future, and I think, again, I'm speaking to the converted, as many of you have gone on to acquire more skills and training in health leadership through this program. It's really important that we lift our head up and look at emerging trends, literature, research that exists about opportunities to do things in a different way, but also being careful to say, is this just a fad? Is there some really sound evidence behind this new model of care or this approach that is appropriate for us to try and explore some changes? The other piece I would say on this bullet is it's really important to look for connections among the social, the political, excuse me, and the economic environments. Some things that we might do, particularly right now in Ontario at this point in the political cycle versus something we might do later in the political cycle, you have to be strategically aware enough of that socio-political environment when you're trying to do transformation. And then lastly on this bullet, on this slide, just thinking about, do you champion change or do you orchestrate change? And they are a little bit different, where championing change is really advocating for that change, and orchestrating change is to shape it into the desired effect. The goal here is, how do you engage people? How do you focus on inspiring and building the partnerships or the coalitions I spoke about earlier, but not forcing them? And then moving on to the next slide, thinking about, in my journey, the places I've had the most success is where I grabbed people's hearts and their minds together. And I know that sounds, maybe it's my social work hat coming out, but we have to really think about what motivates people, because, as leaders, we need our folks to come alongside us in some of this transformative journey. And we've got to understand what motivates them. And I do that across my entire organization. I know across my senior team what's going to motivate them, and if I'm going to need to lean on my VP of Finance colleague, and it's more than just batting my eyes and seeing if I can get some resources, it's understanding what helps him be successful and how am I going to get his alignment. And right through to the frontline staff, you know, when they're hammering through and having some challenges with some of their partners to solve a patient issue, how can I help create change that they can really get behind? I'm not sure how many folks have spent a lot of time exploring situational leadership, but I think it is absolutely key to the development of your colleagues and leaders around you. And when I talk about that, it is understanding where's this person that I'm working with at in their career path and their leadership journey, if they are managers or such below you, and how do I support them. Sometimes you may need to be in a little more on a particular issue, and sometimes you need to be out. And situational leadership is really being aware of when am I in and when am I out to allow that autonomy. But it's also not cookie cutter. As good leaders, we can't lead individuals that work with us the same. They all have different motivations. They all have different skills and abilities. And I would also suggest that's how you look at it individually, but also as a team. I have several different neighborhood teams, several different programs, and I know that each of them have a need for something different in order to be inspired to do their best as teams. I've talked about accountability, so I'll skip over that. The other piece is the values, right? And I talked about that earlier, but really understanding what are the values that we have as an organization, and can our staff align to those values? And when there's a mismatch, what are we going to do about it? What's the conversation? We hope it's not only at performance appraisal time, that it's at other times throughout the year where we can give some feedback and give some examples of how values might not be aligning here. We went through an exercise that was pretty successful just this year that we're going to continue to strengthen, and it's about describing, if these are the values of the organization, how will I, in my role, at whatever level I am, know that I'm delivering on those. The other piece that I think is critical in leading people is supporting a culture of inquiry. And many of you may have done some work around appreciative inquiry, and it's part of even some QI methodology. Thinking through how do I take the best of what's already been happening, and again, not have my lens focused on I know the answer. And I think, you know, by being humble, being authentic, and asking a lot of questions, particularly as your frontline teams, that allows you to be more successful and, quite frankly, more respected, trusted, and effective. I've talked about having teams inform you in decision making, and I've also highlighted that tension between opposing ideas or interests. But remember, the caveat that I'm really trying to nail on this bullet is you got to think both internally what's going on when you're trying to transform your organization or a program or a system, and also what's going on externally, because there are different tensions, and as a good leader, you got to keep all of that front and center and reflect on that. So as I get ready to close off and open up for some questions, if I reflect back on my learnings through my journey, I will be honest to say I am not so good at work-life balance. And as Catherine outlined in my bio, I'm a bit of a person who likes to be going with my hair on fire and really enjoys challenges. Probably have always felt that I needed to prove myself. I will tell you that at one developmental point in my career, I was told, you're a social worker, you won't ever get to a C-suite kind of leader in this healthcare system. And I really took that to heart and thought, I'm gonna prove you wrong. And I probably haven't done such a good job when I think about, you know, time with my kids and some of those things. So here's the caution to all of you. work hard to find that work-life balance. I am working on it now, and I think I'm doing a bit better, but it has been one of the hard things, and especially as an emerging leader and you're trying to prove yourself and you're trying to demonstrate that you can work hard, that has been a bit of a challenge at times. Allowing time for reflection and generative learning. I think we know it intuitively. You know it, and I'm sure you felt the same as I did when I went back to school and kind of opened up your thinking and allowed you to get excited again. There is some research through an Australian study that found that 40% of successful leaders have time dedicated in their calendar spent on creative thinking, strategic planning, and connecting with partners. And by doing that, those successful leaders are more proactive than reactive. And so for many of us, including myself, I think this continues to be a challenge. Knowing that we fail. I am a type A personality, and failing doesn't always feel so good. So that has been, sometimes I've had to really pick up myself and say, okay, I messed up, but I'm gonna get going again. But I have found that I need to allow myself a bit of breathing space. It's probably a couple days for me to do some of that regenerative thinking and overanalyzing perhaps at times. But I think we have to be honest with ourselves that it's okay to fail, and we're going to make mistakes, but that's how we learn. The way I deal with that, though, is really making sure I've got some strong supporters and mentors around me. And so if any of you don't have those yet, that mentor who's maybe a little more experienced, who can give you a bit of perspective from time to time, and sometimes who isn't so close to your day-to-day work, I think that's something that's really been helpful in my journey. Building and maintaining trust, particularly when there's this much transformation going on in the healthcare system, and if you're out there wanting to really create some change, you got to work at this. You need to work at having those coalitions, those stakeholders, and how do you make sure that you build trust? And I am calling this out here tonight just to say it really takes time. You heard me say before, I think it's okay, it's pretty good to set a vision, but if you can't articulate it at the different levels of those who you're going to work with, you're going to lose people. And so that has, for me, I continue to work really hard at thinking through and bouncing off. I pull a few frontline staff aside who have asked me to mentor them a bit, and I said, okay, this is what we're going to come out with. This is how I want to say it. What do you think? Is it going to land or not? And so making sure that we can articulate the vision even more than just setting it. And then sometimes it's really tough to live that systems view, and I think I spoke about that a few slides ago. We do have to think differently if we're going to be strong leaders in this transformative time, and make sure we're not just thinking of our own organization, our own silos, our own program in order to be successful. And that's also how we're modeling the way for many of our staff. My successes, I get myself. I get my flaws. I know my strengths. I've spent a lot of time really investing on taking time to do some in-depth assessments to look at that. And so I know when I'm going to have my triggers. I know when I'm going to get emotional and when I'm going to have to pull myself back. So that has been something that's hard sometimes, but has really helped me. I work hard at these coalition building. I give myself the space to know they're going to take time. But I truly believe that that is the way that we're going to get through this transformative time. You heard in my earlier example, I'm really careful about making sure that the organization, the program, the initiative I'm working on, that I can get behind the values. And I feel that it's key to have a different mix of skill sets working alongside me. So I've worked really hard to recruit, retain, and develop staff and colleagues working around me that have different skill sets so that we can create one strong team together. I won't say that's always easy. It really takes some time for us to gel, and sometimes we, you know, get stuck on some issues because we do have such different perspectives, but it does create the breadth of experience and really makes us stronger as a team to lead forward. And last but not least, I work hard to be authentic. When I started my VP role, the first meeting that I had with all of my entire home care team, I kind of laid it out there in terms of my journey, my personal, you know, the story. I probably went into even a little more detail than I did with you tonight, but I wanted people to understand what makes me tick, what am I going to push for in terms of delivery of home care, and so I'm real. I crack some stupid jokes sometimes. I'm not inappropriate politically, but I'm me. I don't try and fake it, because I actually think people can see right through that. And so in closing, my 3 words on my whiteboard that are guiding me every day right now, and especially during these interesting times: be respected, be trusted, and be effective. And so I hope that I've shared a few of those nuggets with you tonight, and I'm happy to take some questions.
It's Brenda speaking. Catherine, I think you were going to step in here. Hopefully she can hear me. Catherine, you're on. There you go.
Great. I think, Brenda, did you have any of the summary of the chatter from the conversations around some of the questions?
Well, there hasn't really been any questions just yet. I do have a couple things that piqued my interest, certainly, but should I start with those?
Yeah, start with those, and then hopefully we can have some. If you have any questions, please post them in the chat box, and
that would be great. That would be great. Kimberley, first off, thank you so much for your authenticity and just your openness to sharing your experience. And as you said, here in Ontario, we certainly are in challenging times. And one of the things I appreciated about what you said was really articulating your vision, you know, horizontally. And I wonder if you could talk a little bit more, you know, during these interesting times amongst your colleagues, how you kind of, you know, keep your chin up or that kind of thing, or how you're managing. As you said, lots of people are watching how you carry yourself. And I just wondered if you could comment on that.
Sure. It's funny, you know, I've been out at a few sessions lately, and I will admit, you know, I see a lot, oh, here, I'll put my camera on for a sec. I see a lot of the head bob, like, oh, how are you doing? It's tough. And so as a horizontal team within our organization, we're talking about it. You know, there have been some times where there's a bit of grieving to say, okay, what's the future going to look like? We were getting really close on executing some big things, and so how do we keep some of those going, because they do absolutely fit within the environment of the future. So we talk about it. We talk about it as a leadership team. We talk about it as staff teams, and yet there is so much we don't know. That I'm saying to our staff, keep doing what you're doing, keep shining where you can shine, and you know, the rest will shake out. So I believe that it is just through some good collaboration inside and then outside of our walls. I have said to our team, I believe our role is to, you know, in the context of home care, of what I do, be able to identify what some of those challenges and barriers are, and talk about the things that make us excited about, you know, the change in the system. There's some structures that can change. There's some pieces that can change. So let's have an open dialogue about that. Because if we just sit back and kind of go, oh, you know, there's nothing we can do, I don't believe that there's nothing we can do. We absolutely are integral to supporting the future of the system. So that's where we've been spending our energy.
Yeah, and definitely when you hear the phrase like ending of hallway healthcare and hallway medicine, home care has a huge role to play. So that's not going away, right? In fact, it's increasing. So it's about how do we speak the language of the organization with which we're communicating with, which of course is the Ministry of Health and the current government in place. So sometimes we have to change our lexicon a little bit, but no, certainly keeping people motivated during challenging times, and that, you know, the notion of a challenge can vary, of course, but yeah, no, I think it's, people are watching, and we have to carry ourselves in that way, particularly as a leader.
Yeah.
I'm not still seeing any, oh, somebody might have put something in the chat. Does everybody know where the chat area is? It's the box at the bottom. Does everybody see it? Gosh, I don't know what other people are seeing. I know that actually we as you said, Kimberly, that did this, how we practiced it looks a little bit different than how the screen appears. But so it is, I'm not sure if people are seeing what I'm seeing, but that's okay. The other thing you talked about was this notion of subcultures in an organization, and always to be aware of those. And of course, when you're a leader, right, you might not be aware of what's happening in all areas of the organization. How do you make sure that you're keeping an eye on, I don't know, areas that might be a few steps away from your everyday interactions?
Yeah, for me, I make sure I'm visible, I'm approachable, and I go to where the work is. I think it's critical. So within our own organizations, you know, we as leaders have the chance to do that. How often do we come out? Like for my example, you know, going on joint care coordinator visits or meeting with an SPO in a nursing clinic. So I think it's important. And, you know, if you're approachable and you demonstrate that you can actually listen and make some change when people are giving you some constructive feedback, I think you build that trust and people will share. The worst thing I think I would worry about is when those subcultures go underground and you don't get to hear about you know, those opportunities. So for us, you know, we do employee engagement, quick, short. It's not like this massive survey, but we do it every year and a half. And it's short questions, lots of, you know, open-ended, but, you know, pretty pointed, like what's your advice to the senior team was one of our questions this year. And it allows us to at least start to unearth, you know, is there something that we did have a blind spot to in terms of how our staff are engaging or feeling? And then what we do is we create small work teams out of those results. And so that's kind of created the environment where people go, oh, okay, well, I either can complain about it and do nothing, or I can give some feedback and get involved. And so I think that's been important. When I think broader in terms of the system, you know, we're trying to do a new palliative care approach in one of our geographies. And I have been working, you know, really hard to understand there's, you know, a big physician group. We think we've been working with them. We know the strengths. We know what they're looking for. But then there's a really intimate, strong thought leadership group within that. We have to go and tap into that as well, so that we understand what is going to make the difference for strong primary care within this transformed system. And so that's kind of the other, you know, out of our organization subculture example that we've been really careful to spend some time in. Again, though, you can't penetrate some of those if you don't have the relationships. So whether it's the relationships with staff, where they feel you actually are approachable, or with these other outside groups to tap into those different connections of thought.
Yeah, always tricky when they go underground, and then try to prevent that for sure. So I'm understanding that I might not be seeing the same chat box as everybody else, go figure, but one of the questions was, is how do you manage through conflict during kind of trying times, is what somebody has asked.
No, it's a good question. You have to get the conflict on the table first. And so, you know, if I think of an example where we're working with some acute care partners and we've both got respectfully different opinions on a particular issue. You got to get it out there, because we can be all polite and we can be dancing around it, but you know, there's times where I've just had to kind of pick up the phone and say, I'm troubled by this. Can we talk about it and explore what's happening here? Because, you know, we are inspiring our staff across 2 organizations that are kind of getting some different directions. So it is, in my opinion, about calling it out and creating a space where we can say, okay, we both had this perspective, so 2 opposing ideas. How could we get to shared goal? And how can we look at those pros and cons of each perspective? And by, you know, if you're skilled enough to take the time to actually listen to each other, I've found that it's successful to actually get at the heart of things. But I won't say it's easy. If you have felt that you're not, you know, as experienced, I mean, I can think of a time like that. I wasn't as experienced, I wasn't as knowledgeable, but I really felt that there was a wrong path being taken. I had to put my big girl pants on and say, okay, I'm going to open it up and talk about it.
Yeah.
And it was scary at first, but by taking the time to actually say, okay, what do we really want to accomplish here? And what is the problem we're trying to address? Because oftentimes in these scenarios, we're thinking that we're trying to address a different problem than is really what the root cause is. So I try and use a little bit of QI stuff and a little bit of people relational approaches, but you do have to actually call it out and get to that shared purpose.
Yeah. So we've got another question, Kimberly, about how to manage when you can't change the direction of your senior leadership and their plans.
Ooh, yeah. So
might be one of those integrated thinking opportunities.
Exactly,
right?
exactly. And you know that example I gave earlier about using inquiry, using questions. Sometimes, even, I mean, all of us, we get stuck in our thinking, or we think our idea is the greatest idea. Nothing possibly could be better. And it's not because we're arrogant. It's because we really have a belief system that we've kind of worked through about a problem. So I think it's using that questioning that I talked about earlier has been the best way, because then people, they come up with it themselves, because you posed it, they've had to think about something in a different way, and then it is a bit of a piece that they can get on board with. I think the other piece is I hope we create environments where there's healthy debate and challenge that can go on, that's respectful, but is an environment. And so kind of kicking through and going up the ladder a bit and saying, you know, this is what I'm troubled with. Because one of the things as leaders that we always aren't so great at either is explaining why we've made a decision the way we've made. And so, you know, if we could, as someone who disagrees with it, ask a bit of the question, we both might have an aha moment where now we can see the issue from a different perspective.
Mm-hmm. Mm-hmm. Yeah, not straightforward, but you need to navigate. And I love the idea of asking questions. I think that's like that inquiry-based leadership.
Yeah.
So, there is a question, and I know Catherine, not surprisingly, has a question, but Carolyn Gill has asked, what practical strategies have you found useful in that elusive work-life balance?
Work-life balance. I've had to be a little more selfish at times. So we have a lot of board meetings. Well, we have had a lot of board meetings, and it was like almost, you know, every week I would be at some kind of meeting, and yet I knew that I needed to get exercising more, as one example. And so I had to sit down with my CEO and say, I'm committing to this outside thing that's really important to me. I'm going to need to flex, and I, you know, need to have some permission that I'm either going to need to leave a little early that meeting that typically I stay for. So I had to be a little more bold, because we can all be working 24/7, keeping that that phone right beside us, and we have to create that space. So I do a lot of now calendar management. You know, I do not book, so I create my integrative thinking time, and that outside time has been really key for me.
Yeah. It looks like there's been a question sent directly. So unfortunately, you can see that we're going over. We had talked about 8:15. I think we had meant to say 8:30, not surprisingly, Kimberly. We are managing it. Of course, we're recording this session, which is great. So people, if you do need to leave, we'll just finish up here. One more question, and then Catherine is going to come back. So I think if you look in your chat box, Kim, that there may be a question there for you. Can you see it?
No.
Okay, she can't see it. Catherine, do you want to come back on the line here and close things up?
My quick question is for leadership development. So over the next 5 years, what kinds of professional development courses should future health leaders take and current health leaders take? So those may be transitioning from frontline to management, and then those from management to director. Are there any courses or topics you feel are really important over the next 5 years?
Yeah, it's I find it hard to pick a specific program as like the shining star. I do think getting involved in sessions like this, I think partnering and watching what the college is offering is key. The other piece is I would really encourage people to step back, do that developmental self-reflection, and see where do I feel that I don't have the confidence in a certain skill set or approach. I feel quite strongly about that concept of really building that emotional intelligence. So I really encourage my folks that I'm working with to make sure they've got some of those skill sets. I think the other piece that I, in particular, have seen people in leadership growth struggle a bit with is that system level thinking, to really kind of look at that socio-political environment and think about some of those elements. So those would be a couple areas in terms of areas of focus, Catherine. But I do think, there's more and more great education opportunities. Sometimes it's even crossing over into a little bit of the business side of some of our work, watching what's going on in other jurisdictions. I think it's going to be really important that we lift up our head and look outside of our context. And that's what I love about your program in terms of really seeing that Canadian landscape, because there are some jurisdictions within Canada that are doing some really neat things. So those are a couple big areas. But also if you think of, moving into your first management role, really having the toolkit, and many organizations are trying to build that now internally, but being honest with yourself, my first management role, I was not at all prepared for, and I didn't do so well, and my mistake was I didn't raise my hand up and be humble to say, I need help. It's okay to ask for help and reach out and see what those other programs and approaches. And the last piece I'll say is mentorship. Get some of those mentors. Get somebody who you respect, you've watched them in action, who you could, once a quarter, sit down with, have coffee with, use a few scenarios to work through and say, how would you do this? What do you think? Nobody's going to give you the answer, but they are going to test your thinking, and I think you should embrace that.
Thank you. I just wanted to thank you again on behalf of the program and the alumni for taking the time this evening. This is our inaugural event, and first time we've had an online lecture, and so just thank you so much for being patient, but really to be so honest with your opinions around leadership and some of your personal triumphs and some of your personal challenges with your journey. So thank you again for all of your thoughts. And to the group, again, we will be sending an email to the development of the Alumni Network, and we encourage those who want to be involved to please come forward, be involved, volunteer. We're looking for those that want to assist with being in the network, also lead the network, and we'll have further conversations on that over the next coming months. Again, if you have any questions, there's our email is posted. And with that, thank you again, everyone, for coming online this evening. And to Kim, thank you so much again for your time. Have a good night. Thank you.